Hi, my name is Barbara Sondheimer, and today I'd like to speak with you about what a plant-based diet might be able to do for you. What if I told you that you could help control your blood sugar levels, lessen your risk for heart disease, and have more energy? Would you take the plunge and switch over to a plant-based diet? It's not as hard as it sounds, and there are lots of benefits if you do make the change. Switching to a plant-based diet could even help stop cruelty to animals and also helps the environment. This is an important health topic for everyone to consider because it could help manage several chronic medical conditions. It could also give you a healthier life. Of course, you could ask your medical doctors if switching to a plant-based diet would be something you should try. I decided to try out a plant-based diet after my A1C climbed to a high of 11.6. This is a very dangerous level where complications might happen. That's when my doctor said if I didn't lower it, I would need to go on insulin. Well, then and there, along with my other medications, I decided to eat healthier by changing to a plant-based diet. Now my A1C is a low 6.6. This is after about 13 months of monitoring my blood sugar levels. During these months, I have studied a lot about the plant-based diet and have taken many free classes at Kaiser Permanente. See if your health insurance provider offers free classes for members to take. Some items I'd like to talk about. Why you should change over to a plant-based diet, some benefits of eating one, reason people use not to start a plant-based diet, tips on how to transition over to one, plant-based meal plate and what it should look like. Why a plant-based diet? Cardiometabolic disease, namely ischemic heart disease, stroke, obesity, and type 2 diabetes, represent substantial health and economic burdens. Almost one half of cardiometabolic deaths in the United States might be prevented through proper nutrition. Plant-based vegetarian and vegan diets are an effective way for improving nutrition intake. At the same time, they are associated with decreased all-cause mortality and decreased risk of obesity, type 2 diabetes, and coronary heart disease. There is evidence that suggests plant-based diets may help reduce the risk of coronary heart disease events by an estimated 40% and the risk of cerebral vascular disease events by 29%. These diets also reduce the risk of developing metabolic syndrome and type 2 diabetes by one half. This is from Hannah Kinvola, Susan Levine, and Neil Bernard, Physicians Committee to the Responsible Medicine at George Washington University School of Medicine and Health Services. From 2017, cardiometabolic benefits of plant-based diets. Benefits that you could get from a health-based diet include help controlling your obesity, unhealthy and high cholesterol levels, maintaining your diabetes symptoms, some types of cancer. This is from John Grant, a pediatric emergency physician and professor in the Department of Emergency Medicine at Dalhousie University in Halifax, Canada. Time for a change. Benefits of a plant-based diet. Next, we'll go over on how to transition to a plant-based diet. Transitioning doesn't have to be difficult. With little planning, it's easy to get all the nutrients you need from plant sources without relying on highly processed, refined foods. For many, the transition to a plant-based diet is gradual. Observing a meatless Monday is a big campaign, and you could Google that on the internet. Begin with one plant-based meal a day and then move on to 2 meals a day. Start eliminating the worst offenders from your diet, such as bacon and cheese, and have a fresh vegetable dish or 2 with every meal. This is from Nikila Cook Carlson and T. Colin Campbell, a plant-based light, Amazon print from 2016. One of the founding members of T. Colin Campbell's Center for Nutrition Studies. Now, some reasons that people give for not wanting to start a plant-based diet are that it's too expensive, which can be combated by buying fruits and vegetables when they're in season. They're a lot cheaper. You can also buy items like grains, oatmeal, and beans in bulk. it's also, sometimes they say it's too difficult to maintain. This isn't true because it's very easy to transition over to a plant-based diet. You can start by doing it over time, and then over time, a little bit, it will become second nature and you won't even have to think about it. Start off with maybe like 1 or 2 meals a day or even weekly to help you transition over. Now this is what a plant-based diet plate might look like. Half is full of fruits and vegetables. Third is from protein-rich foods like tofu, beans. And the other third is whole wheat bread and whole grain foods. This is from Hannah Susan Levy and Neil Bernard, Physicians Committee for Responsible Medicine, George Washington University School of Medicine and Health Services. Sample menu for a day: breakfast rolled oats with walnuts, banana, and a sprinkle of cinnamon. Tomato basil soup, whole grain crackers with a simple side salad and an apple. Dinner could be vegetarian chili with a spinach orzo salad. In summary, a healthy plant-based diet requires planning, reading labels, and discipline. The recommendations for patients who want to follow a plant-based diet may include eating a variety of fruits, vegetables that may include beans, legumes, seeds, and whole grain foods, and avoiding limiting animal products, added fats, oils, and refined processed carbohydrates. The major benefits for patients who decide to start a plant-based diet are the possibility of reducing the number of medications they take for a variety of chronic illnesses, lower their body weight, decrease risk of cancer, and a reduction in the risk of death from heart disease. This is by P.J. Tuso, M.H. Ishmael, Carol Bartolo, Nutritional Update for Physicians Plant-Based Diet. Tuso is Regional Co-Lead for the Complete Care Program of the Southern California Permanente Medical Group and the National Physician Lead for the Care Management Institute's Total Health Program. You should. Now, I've gone over quite a number of topics like what is a plant-based diet, transitioning over to one in a healthy plate. I hope that you'll try and look into having a more balanced meal and get more energy from a plant-based diet. Here are my note cards. You should look into the China study and Forks Over Knives are two important documentaries. You can Google and look up on YouTube and watch them for free. Thank you for giving me a moment of your time, and I know you'll want to switch over to a plant-based diet.